Hi guys, how you doing? Eddie Wagstaff here, physiotherapist and director of Core Body Clinic. I wanted to talk to you a little bit about what we have here and what we use as our treatments. And one of the things we use is Focus Shockwave. Now, Shockwave's been around for a long time and was originally used to blast away the stones that would form in your kidneys, and it's still used today to great effect. And what Shockwave is basically pressure waves that are delivered from the transducer and basically deliver pretty high energy shockwaves into your tissue that can affect physiological changes within the tissue. What we know, it increases cell permeability, it increases microcirculation by not only encouraging vascular growth but also by increasing cell permeability and vascular permeability. And also it releases a neurotransmitter at the periphery called substance P, which is really effective at reducing pain. What we use as Focus Shockwave has slightly different effects to radial. It increases the release of nitric oxide, and this is really important for cell metabolism, neoangiogenesis, which is actually the growth of blood vessels, and this is very important if you've got a chronic tendinopathy or if you're suffering from erectile dysfunction. You want the growth of vascular bundles so that the tissues regenerate. Focus Shockwave also, as a result of that, has an influence on the stimulation of growth factors. So it actually means that not only does it reduce pain, not only does it cause the transient effect of cavitation in the tissues and bring about these small short-lived changes, it actually affects a longer-term changes within the tissue. So common things that you would treat with it would be Achilles tendinopathy, calcific tendinitis of the supraspinatus or the subscapularis, sometimes the infraspinatus. We also use it on plantar fascia heel pain, so that is planterfasciitis, the pain on the bottom of your foot when you walk. You can also use it for other things like osteoarthritis of the knee, and this is particularly focused shockwave, not radial, although radial is very effective for plantar fascia and for tendinopathy. The really important thing about Focus is that we use is that it fires the impulses in a linear fashion. That means basically wherever you point the transducer is pretty much where you get the impulses. By contrast, radial applies the pressure waves at the surface of the skin and is very effective within a centimetre or two, up to 4 centimetres, where Focus Shockwave can still maintain the energy at around sort of a depth of 8 centimetres. When you're treating things like calcific tendinopathy, it's really important to use ultrasound so that you actually target where you are applying the cavitation, or where you're applying the pressure waves. It's very important to actually target the most dysfunctional part of a tendinopathy, and also to measure the thickness of a plantar fascia. And this can often determine whether you do an injection or whether you do Focus Shockwave. We do use it for osteoarthritis of the knee, and again it's very important to scan first so that you're not irritating an already highly inflamed knee. And this is very important, because this will make your symptoms feel even worse. So we tend to combine the use of ultrasonography, because I'm a musculoskeletal sonographer as well as a physio, and so that we can determine the best way to treat your problem, and that is why we combine the two together. Other things that you can use Shockwave for, and bear in mind, these are the most effective things that we've done research on, and we can confirm that it is indeed effective. So that's plantar fasciopathy, plantar fascial pain, tendinopathy, particularly in the Achilles and the knee. We do use it in the hamstring as well, although most of the research is in the ankle and in the Achilles and also in the knee. And also for calcific tendinopathy, and that's evidence-based. There is some good evidence that it works for non-union fractures, although that's by a case-by-case situation. And also we use it in men's health. So I'm also a men's health physio, so I see chaps that have got pelvic pain, and I also see chaps that have got erectile dysfunction. But again, we have to assess those individuals. It's very effective for people that have vascular degeneration of their erectile tissue, but it may not be so good for someone that's a lot younger that may have erection problems for other reasons. So it's very important to determine case by case. And there's lots of things that you can use Focus for. We do use it for tennis elbow as well, and we have used it for golfer's elbow. Again, research is fairly good here, not much research done for golfer's elbow, but again, if you can extrapolate that information from one tissue to another, and one syndrome to another, then you're probably going to get a good result as for its use and efficacy in those conditions. So Focus Shockwave is very effective for degenerative conditions, and can really help regenerate and reduce the pain that you're having, and is a worthwhile consideration in both musculoskeletal and also men's health, and that's what we do here at Core Body Clinic.